I'm Troy Kirby with a quick look at the 2022 Washington State Legislative Session. The 2022 Washington State Legislature debated the ability for a pregnant individual to access abortion care with Engrossed House Bill 1851. The House heard the bill on the floor on February 11th.
As a healthcare professional, I believe that abortion care is healthcare. House Bill 1851 aims to preserve a pregnant individual's ability to access healthcare. That simple. It updates the Reproductive Privacy Act to clarify that which providers can provide abortion care by codifying two Attorney General's opinions, namely physician assistants and advanced registered nurse practitioners, and the advanced healthcare provider who practice within their scope.
We have a board of services pretty expansive in our state. Women have access to abortions. That is not what this bill is about. What this bill is about is protecting our most vulnerable. You and I, as professional women, if we did choose to have an abortion, we have the ability to do our research and look at what kind of healthcare provider we would want to take care of us and make sure that we had somebody with adequate training. However, younger women who don't have the education that we have, who don't have the resources that we have, and show up at a clinic without many options, they don't have that ability to look at what type of provider that they want to choose.
The thought of an abortion for one of them scares me to death. But if worse than that, the thought of if they had chose that way of taking care of a situation scares me worse, that there's a possibility of a non-physician handling that procedure.
We know for a very long time that a number of different healthcare professionals have had in their scope of practice abortion care. And Washington is known to be a state where abortion is accessible and safe. And we know, Madam Speaker, that we want all patients to have access to safe and accessible healthcare.
During testimony, we heard that there were some individuals who were biologically a woman. They kept their female parts, chose to transition to become a man, then became pregnant, and then chose to get an abortion, and were offended that, at the abortion clinic, that there was the terminology of women. This underlying bill would have changed all of the verbiage from woman to pregnant individual. I have previously stated on another bill how I had concerns, as well as other women, and how proud we are of being women. And so this amendment is a better medium that would basically say that we would keep the verbiage of women, but then also include pregnant individuals to address the concern of that very small minority.
The bill passed the House 55-40 on February 11th, then moved over to the Senate, where it was debated on March 1st.
Attorney General's opinion is just that, an opinion. There have been many Attorney General's opinions that have not proven to be correct. What we do know is that back in 1991, the people of our state passed a law based on the fact that only a physician would do the abortions. This was a safeguard that was publicized in the voters' pamphlet and used by those people favoring the campaign.
Though grateful for Senator Padden's continued concern for safety in accessing legal abortion for women and pregnant people in Washington, But rising to say that these are not new providers, we are asking to complete these procedures. These are providers who have been safely providing this care to pregnant people in Washington for quite some time.
If this truly were about individuals who are already providing this type of service, then why do we need the bill? I mean, to me, this is something that is entirely new, and it's being cloaked under something that already exists.
Anybody that knows me knows that I have a severe reaction when I hear people who want to get an abortion. I know people who have, I know people who have regretted it, but it's the law. But this bill, it's the law currently in the state of Washington. This bill expands the folks that will be able to perform abortions. This amendment simply says, if you're going to do an abortion or assist in an abortion, you need to be certified by the Washington Medical Commission and the Nursing Commission to be able to perform it.
This is not, the underlying bill does not expand providers, the number of providers performing abortions. It simply codifies recent Attorney General's decision.
You'll notice that people are talking about, they're not talking about physicians doing this surgery. They're talking about providers. And if I recall correctly, in the past, the bill said, pardon me, only a physician can terminate a pregnancy. Well, I believe that's not the case anymore. That meant that somebody who was a healthcare professional could do preparatory work. The physician could terminate the pregnancy, and then a person, a healthcare professional, could then do a follow-up after the termination of basically the killing of the baby.
The Senate passed the bill with amendments on March 1st by a vote of 28-21. Then it moved back over to the House to see if representatives would concur with the Senate amendments.
The Affirm Washington Abortion Access Act codifies the AG's opinions on who can provide abortion care. It ensures abortion care is accessible to all pregnant individuals. The amendment removes the gender-specific terms. I ask for your support.
Unfortunately, I'm rising in opposition to this bill and also to the concurrence of what the other body across the rotunda has done. They actually made a bad bill even worse. The underlying bill will take two types of healthcare providers, physician's assistants and nurse practitioners that have currently no education on abortion training, and they will allow them without additional training to perform abortive services to some of our most vulnerable women in our state. And that's wrong. But then fortunately, we were able to come here and come to an agreement on some of the terminology, because there were people who were women and transitioned to be a man, kept their female organs, got pregnant, then wound up choosing to have an abortion and were offended that there was the words women in the clinic. I, however, am a woman. I'm very proud of being a woman. And I'm also very offended to be considered a birthing individual, a pregnant individual, a gestational parent, or any of the other neutral terminology that has been proposed here. I'm very grateful for the good woman in the 34th District to work with me on language to include both gender and non-gender terminology. And unfortunately, the other body across the rotunda, they chose to cater to a small minority and offend those of us women who are proud to be women.
The House concurred with Senate amendments by a vote of 57-41. The bill now makes its way to the governor's office for an opportunity to be signed into law. Thank you for watching the 2022 Washington State Legislative Session.